been a fantastic conference. There were speakers from America, Canada, Brazil, and one or two English speakers. And everybody had one theme in common, and that is, can our knowledge of spirituality help in the treatment of medical patients? And the answer to that was, yes, certainly it can. The relationship between spirituality and medicine, and as we all know, this is terribly important in speeding the healing process, both for those in and out of hospital.
To step up and express a moment of gratitude before the programme begins. Thank you, Elsa.
Good morning, everyone.
Right, everybody, so carrying on with our programme this morning, I'm now happy to introduce you to Dr. Marcelo Saad. A little bit of his background. It's quite an impressive CV, so bear with me, please. Marcelo Saad is a PhD in physician specialized in physiatry and acupuncture, member of the Interfaith Coalition on Health and Spirituality. He's currently a president of the Spiritist Medical Association of São Paulo and a collaborator of the Spiritist Medical Association of Brazil in the organization of events. He's a collaborator of the International Spiritist Medical Association for conferences abroad. Besides his work as a physician, he develops activities in scientific publications, editorial boards of medical journals, technical lectures, and participation in scholar tasks. His interest fields are spirituality in health, acupuncture, and complementary therapies. Please join me in welcoming Dr. Marcelo Saad to the stage. Thank you very much.
Good morning. I'd like to thanks for the organizer of this event for the opportunity to be here once more. I will talk about the Spiritist Chaplaincy, a model for faith support in hospitals. Initially, I would talk about chaplaincy as a whole. But by suggestion of Dr. Peter Fenwick, we will focus in the Spiritist view. In my next talk, I will talk more about Spiritism in case you don't know all the premises of this knowledge. We will see in this presentation, in first place, the importance of religious support in hospitals as a whole, for everybody in all forms. Then we will see the need for a Spiritist chaplaincy, some cases of success, and forthcoming perspectives. So in first place, we have to remember that the inpatient has characteristics that fragilize him. The patient is far from his pillars of faith and disconnected from their belief rituals. So the hospitals and the inpatient institutions should engage to compensate for the absence of their traditional methods of religious coping. This is an invitation for all the institutions to invest in this field. So we stated the religious spiritual hospital assistance in this synthetic conception that I found in a work of Van der Kreek, saying that the religious spiritual hospital assistance is the professional attention to the subjective religious spiritual world of the assisted worlds composed of perceptions, assumptions, feelings, and beliefs about the relationship of the sacred with his illness, hospitalization, and his recovery or possible death. So it is an individual need for each patient, and it has to be tailored according to the necessity. Who are frequently the assisted people for this religious spiritual hospital assistance? We call them the clients, but I state that in Portuguese, client may be a commercial connotation. Here we are talking about clients without this commercial connotation. They are the target public of this assistance. And commonly we remember the patient and the family. But we also have to have in mind that the caregivers also suffer a lot with this stress and need this assistance, and also the healthcare staff. The caregivers suffers a lot. Anciently, I learned that when someone wants to study stress, there are two main people that they can make the research. They are flight controllers and caregivers, mainly in Alzheimer and dementia people. And the healthcare staff must be also remembered as a target public for this assistance due to the occupational stress they are submitted. The main objectives of this assistance is to help the assisted or the client to find meaning and purpose in the situation. As Viktor Frankl stated, what crashes the human being is not suffering, is the nonsense suffering, the suffering without a sense. So we have to find a sense with the patient for the situation. To cultivate hope and acceptance, hope must be present in all stages of the life of the person. If it's not a hope in healing, is maybe a hope in symptom control. If it's not a hope in symptom control, it is a hope in a pacific passage for his death. So hope may always be present. To recognize limitations and strengths, because the patients sometimes don't acknowledge how strong he is, and don't acknowledge also the weakness, the frailties, and this assistance may help him or her. And it's always interesting to differentiate the chief complaint and the chief concern. The chief complaint may be, I have a mild headache, and the chief concern may be, do I have a cancer in my brain? So there is not a direct correlation between them, and we have to be sensitive to this suffering hidden in the chief concern. There are many ways to offer this assistance, and they are divided in many categories. If we consider the religion, it will be a specific denomination assistance made by a cleric that can offer the rituals, or can be in a multi-faith or interfaith manner with universal values that can serve for everybody. The linkage of the offertor, the provider, with the institution, he may be a hired professional, such as an institutional chaplain, and or visitors that come to the hospital upon request. The provider may be an ordained clergyman that can really offer the sacraments and the rituals, or some trained volunteers that can be taught to offer some superficial assistance for a large number of patients. And about the role of the institution. The institution may seek proactively the needs of the patients, or to be just reactive to a request. This second position may seem to be less invasive and most respectfully for the patient, but in many times the patient will not express his or her needs unless he is asked for. And the providers of this assistance, commonly we associate this kind of religious spiritual assistance with the figure of chaplains, but there are many other possibilities. Remembering the difference, chaplains are religious spiritual caregivers, but not all religious spiritual caregivers are chaplains. We explored some varieties in the previous slide, but there are also other possibilities to offer this assistance. And even concerning the hospital chaplaincy, we know that this term have roots in the Catholic culture, but today the term transcended the Catholic field to mean every person is skilled, trained to offer this assistance in the hospital environment. So there are Jewish chaplains, Muslim chaplains, etc. And currently there are chaplains of many faiths, many different faiths, and also some professionals skilled to offer multi-faith chaplaincy or assistance. And also people have to have another view on the hospital chaplaincy, because many people has the idea that all chaplains are Christian priests. So if you ask the patient, do you want to see a chaplain? He, if has this view, may say, no, I don't want. And not all religions' visits are for anointing the dying. People frequently associate, especially in Brazil, that the visit of a clergyman, of someone to give some spiritual assistance, means he or she is dying. And this is not true. We have to change this culture. This is to show some general aspects of the chaplaincy as a whole for all patients. And now we will say the need for a Spiritist chaplaincy, Spiritism, that I will detail more in my next talk, have about 30 million followers in the world. But 1 out of 3 Spiritists are Brazilian. The main population of the followers of Spiritism are in Brazil. In Brazil, Spiritism is the 3rd larger religious affiliation, is just behind the Catholic and the Neo-Pentecostal Protestants. And they make 3.8 million people. That corresponds to 2% of the population. And this number may be even higher, because the supporters may be 30 millions that not declare themselves as Spiritists, but they attend for some activities and read some books according to the Brazilian Spiritist Federation. So it is a very important denomination in Brazil. And notwithstanding this large presence of the Spiritism among the Brazilian population, there are very few groups dedicated to come to the hospitals to make spiritual religious assistance focused in this need. Some groups make punctual visits among requests normally, and they don't have a formal flow for these patients. And these groups that serve that needs have some limitations, as all external visitors has, because a visitor that comes to the hospital upon request, they are not formally educated to the hospital environment. They make a counseling and teaching in the Spiritist centers, and they are not well trained for the hospital. These visitors are not linked to the continual plan of care. They are not linked to the healthcare team. They do not write in the records of the patient. They are not present in the discussions of the case of the patients. And the availability is restricted. They go there as they are available, and there is always a risk of proselyting when you receive a visitor external from the institution. And the Spiritist patient will have some specific needs. I showed here some tenets linked to healthcare that are from the Spiritism. It will go on in the next slide also. In the first place, the Spiritist taught that the spiritual is the immaterial essence of the human being. This is common for many religious denominations. Following, the nature of the spirit is made of a subtle immaterial reality that we cannot yet access. The spirit incarnating is called a soul. So the difference of spirit and soul is just the soul is a spirit that is incarnated in a material experience. The diseases, whatever they are worsened or caused by unbalanced forces and energies of the soul. So this imbalance in the soul and the energies may reflect in the body, causing or worsening some diseases. The soul is responsible for all the mind properties. So the brain just transmits what the soul produces, but the brain is not the origin of the mind. The mind can capture information beyond senses, either in the case of the mediums that can receive messages, or subliminally in an inconscient way. Other spirit tenets is that the spirits may influence health states of individuals. We are surrounded by the spiritual world, and we are in a frequent relation with the spirits. So we can improve with this influence or get worse. The communication between spirit and man is called mediumship when it is ostensive and can transmit a complete message. After that, the soul keeps its individual personality. We recognize ourselves in the spiritual world as we recognize in material world the same way. And the spirits must go through many reincarnations in order to perfectioning and improving to get closer to God. These are some of the tenets of the Spiritism just related to healthcare. I will say now some cases of success. In first place, we have to create a culture about the Spiritist Chaplaincy that we are doing now. In second place, I will say one experience in a general hospital in Brazil, and I will say a little about the Spiritist hospitals that are a little bit common in Brazil. The creation of a culture is making by some publications in medical scientific journals with this term, Spiritist Chaplaincy. I started this in 2015, and I put this shy title toward the concept of Spiritist Chaplaincy, and I detail the idea, and a colleague of other city in Brazil reported the experience of their group in a hospital and an update in 2018. So we are trying to create a culture with these publications, mainly in this very prestigious journal of medicine. The creation of a culture goes on with a book that was published in 2016, the Spiritist Hospital Chaplaincy Theory and Practice, that was published by the Spiritist Medical Association of Brazil. Is a book, and 35 authors, me included, from several Brazilian states that collaborated to this book. Unfortunately, only in Portuguese, but we intend to establish some frontiers, creating some points, some cornerstones. And we go on relating an experience on a general hospital. In São Paulo, Brazil, we have the Hospital Santa Maggiore that is dedicated mainly for old age population. It's a general hospital with 107 beds for the elderly, and starting from March 2012, we started religious visits from 3 different religious denominations. That is, the options that were offered to the patients was the Catholic priest, the evangelical pastor, the neo-Pentecostal, and the Spiritist volunteer. And it's interesting that some patients request more than one, showing the Brazilian people are very mixing cultures. They mix a lot of concepts and construct their own. The buffet, multi-faith, or also known as cafeteria religiosity. You pick each thing you want to pick in each religion. And these images come from footage of a video that was released in a program in Brazil, showing the priests, the evangelical pastor, evangelical shepherd, and me as a Spiritist visitors. And the curious is that the hospital created a non-invasive institutional flow, because for each new patient that was in the hospital, a concierge, a guardian, I don't know exactly the term, went to the bed of the patient and asked whether he wants or not a religious visit. And he creates a list for each religious denomination, and when the religious leader come to the visit, receive the list with these names specifically, so they don't go to other rooms. And I will resume the Spiritist Assistance I made at that time. This assistance, this visit, has 2 main components. I gave a message and a prayer. This is according to branches of Spiritism, that is the consoling aspect and the Redeemer aspect. These are 2 aspects of Spiritism, and we try to reach both with a message and a prayer. The message, that is the consoling, the aspect of Spiritism, is the God's presence in every situation of our lives, His wisdom, His justice, His goodness. Everything happens for a reason, and remember the patient that our beliefs give us strength to and meaning to move forward with faith and patience. That is important to these moments that are out of our control. So the patient can be more motivated to go through these afflictions and this disease. And God sometimes is the Father who refuses His children something it is inconvenient. So while we don't understand everything, we just rely in the justice and the kindness of God, and sometimes we wish to understand all the things will make sense. Just for now, we have to have faith and patience. And the prayer, the Redeemer aspect of the Spiritism, we elected the prayer afflictions of life that come from the Gospel according to Spiritism. And it says, God omnipotent, who sees all our miseries, please deign to hear the supplication we direct to you at this moment. If my request is inconsiderate, forgive me. If it's just inconvenient, according to the way you see the things, may the good spirits who execute your wishes come to my aid and help me to realize my request. However it may be, Lord, let your will be done. If my request is not answered, it will be because it is your wish that I be tested, and I submit without complaint. Help me not to become disanimated, and that neither my faith nor my resignation be shaken. This is a general prayer that put in the God's hands all the faith that don't ask anything specific, a specific outcome, and may create a sensation of that everything is making sense and it's under control. The potential activities we can make with the patients is the emotional support that is different from the emotional support of the psychologist, is another kind of suffering. Doctrinal counseling, if the patient has some concerns about organ donation of some other sensible subject, we can offer the magnetized water, that is a fluidified water, energized water, that we intend to balance the soul. Spiritist healing, the laying on of hands, the bedside prayer, to be intermediary in crisis, to interpret the suffering of the patient, and sometimes communicating it to the healthcare team or the family, bridging a link with the community to bring the patient the ritualistic material he wants, to make distant prayer also, grief support for the family, and also prayers to discarnated spirits. If the dead come for this spirit, for this assisted, we also continue to offer things to the family or for his spirit. However, we don't got yet to make a real Spiritist chaplaincy, because we are now offering the visits in a irregular way. We go to the hospital frequently, but we are not linked to the hospital. So we make chaplaincy activities, but we are not actual chaplains in the sense that we are linked to the institution. We try to evaluate in this sense also. And another case of success are the Spiritist Psychiatric Hospital. In Brazil, there are more than 50 institutions. Some of them have many decades of existence. And they offer the conventional treatment, always, such as medication, psychotherapy, etc. And the patient who wants to, he may receive also the complementary Spiritist treatment that I will say as follows. So this is made in a totally free choice for the patients. The treatments that can be associated to the conventional treatment, maybe the laying on of hands, the fluidotherapy, I cited the magnetized water or energized water, some lectures, some studies on gospel issues, the disobsection that is released from the influence of external spirits, the prayer, either present prayer or at a distance, and the fraternal orientation for specific needs of the assisted. And this is a research made by a colleague in Brazil. He studied the 6 leading Brazilian Spiritist psychiatric hospitals, and he found these hospitals serve the public health and some private patients. They also have daycare and outpatient treatment, not only for the inpatients. They treat many diseases, depressive disorders, drug addiction, psychotic disorders. Continuing. The patient may be follower of any other religion. There is not a criteria to receive the patient what is his or her religiosity. And some hospitals address other religious needs also. If the patient needs some assistance for other religion, the hospital will provide. They also offer spiritual care to the employees. The workers at the hospital also participate, if they want, in the activities that complementary modalities I cited. And all spiritual treatments are free of charge to patient and the staff, and always free in choice also. As a result of this model in psychiatric Spiritist hospitals, this author cited, when visited these institutions, that this integrative model for mental health is very useful, especially for drug addiction and depression. The impression is of benefit, although there is no qualitative research, but really is visible the improvement of the patients. And for success, hospitals, clinicians, and patients have to embrace the model. When it happens, it seems to be a useful model. And so useful and so successful that it is creating Spiritist healthcare tourism. Some people from North America organized to come to these hospitals to see the practices, the results, to learn some things, maybe to also reproduce in North America. There are also some organized groups that come regularly to these hospitals. And finally, as forthcoming perspectives, we see in the Spiritist Chaplaincy some challenges and some opportunities. The challenges is the prejudice against Spiritism we suffer in Brazil. Some Christian fundamentalist groups condemns the activities of Spiritism as devil works. So we are constantly with this rivalry. There's conflictant patients' and relatives' beliefs when the patient is of one denomination and the relative is of other denomination. There may be some conflict and difficulty to make the assistance. But we have opportunities as some institutions like the Joint Commission, the North American institution that accreditates the quality of hospitals, this institution, in their visits to establish the accreditation of this hospital, demands some things related to spirituality. And one of the questions they make is, the hospital have to provide care that respect the patient's personal values and beliefs, and to respond to requests related to religious spiritual needs. Based upon this, we can expand the assistance for some hospitals concerned with the quality and accreditation. However, we have also an inner challenge. In Spiritism, there is not hierarchical clergy, there is not ordination. So it's difficult to decide which people are skilled to make this assistance for patients, and this may be constructed yet. Some institution in Brazil will centralize the education about this and have to follow these people and reaccreditate them regularly in a program that must contain a doctrinal education on Spiritism, pastoral experience in assisting the target public, and some hospital environment training. Even if we don't have this formation, we are engaged in an initiative that is the Interfaith Chaplaincy. We have in São Paulo, Brazil, this Interfaith Coalition in Health and Spirituality that are a combination of health professionals and religious leaders linked to offer models of interfaith hospital chaplaincy. This is a multicolor reunion with healthcare professionals, with religious leaders, and I am here representing the Spiritist movement. Based on this gathering and this experience, we are creating on this Interfaith Coalition for Health and Spirituality a post-graduation program on interfaith chaplaincy. All the leaders and all the healthcare professionals will collaborate to join their knowledge to create this initiative, post-graduation course in this School of Medicine, Santa Marcelina, and we intend to start in February 2020. This specialization is very deep, will be 360 hours long, and we expect to form people skilled in interfaith dialogue. And for the future, maybe we use initiatives like this one that is already in course in North America. That is a non-presential assistance. This healthcare chaplaincy network proposed a model of tele-chaplaincy that may reach the assisted by email, by phone, or by video call. This is an initiative to offer the assistance, whatever the model is adopted, to a broader population. We don't have to have the professional in the place, but we can offer it at a distance. And as a conclusion, the religious support in hospitals is very important for the inpatients. It's important for everybody and for all patients, but is most preeminent in the inpatients. There's a need for the development of a Spiritist Chaplaincy model, mainly in Brazil, and this new pathway will be based on cases of success, such as that I cited, and on incoming perspectives that will come from the future. I finished this presentation with this phrase of the Reverend Sue Wins, North American chaplain, that stated that people don't care how much you know until they know how much you care. So maybe in the near future, the clients will choose the hospitals as they choose the flying company today. You assume that all flying companies are competent, the pilots are well skilled, the technology is the same for all them. What makes you choose one air company from other is the way that company respect your needs and go through your desires and fulfill your needs. And this is to remember us that no spiritual assistance is small, because even a small flame may light a candle that can transform the environment and multiplicate what seems to us very small. I am available to continue to contact you at this website, and I thank you for your attention.